Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 30 practice questions. With out the way, let's get started.
The nurse is discharging a client diagnosed with COPD. Which discharge instructions should the nurse provide regarding the client's prescription for prednisone? 1. Take all the prednisone as ordered until the prescription is empty. 2. Take the prednisone on an empty stomach with a full glass of water. 3. Stop taking the prednisone if a noticeable weight gain occurs. 4. Do not abruptly discontinue taking the prednisone. The correct answer is 4. Do not abruptly discontinue taking the prednisone. Prednisone is a glucocorticoid steroid. Prednisone is not abruptly discontinued because cortisol is necessary to sustain life, and the adrenal glands stop producing cortisol while the client is taking it exogenously. Prednisone can produce gastric distress. It is given with food to minimize the gastric discomfort. Weight gain is a side effect of steroid therapy, and the client should not stop taking the medication if this occurs. This medication must be tapered off to prevent a life-threatening complication if the client is to stop the medication. The female client is being admitted to a medical unit with a diagnosis of pneumonia. Which intervention would the nurse implement? Rank in order of performance. 1. Start an IV access line. 2. Administer the IVPB antibiotic. 3. Teach to notify the nurse of any vaginal itching. 4. Obtain sputum and blood cultures. 5. Place an identity band on the client. The correct order is 5. Place an identity band on the client. 4. Obtain sputum and blood cultures. 1. Start an IV access line. 2. Administer the IVPB antibiotic. And 3. Teach to notify the nurse of any vaginal itching. The laboratory technician who will draw the blood cultures will need the band to identify the client before drawing the specimen, and the nurse will need the band before administering the medication. Checking for the right client is one of the 6 rights of medication administration. Cultures are obtained prior to the initiation of antibiotics to prevent skewing of the results. An IV line must be initiated before the nurse can administer IV medications. IV antibiotics should be administered within 1 to 2 hours of the order being written. This should always be considered a now medication. Superinfections are a potential complication of antibiotic therapy. Vaginal yeast infections occur when the good bacteria are killed off by the antibiotic. Diarrhea from destruction of intestinal flora is also a possibility. The nurse in a medical unit is administering 9 o'clock medications. Which medication should the nurse question administering? 1. Acetylcysteine to a client who is coughing forcefully. 2. Cefazolin IV piggyback to a client diagnosed with the flu. 3. Diphenhydramine to a client who is congested. 4. Dextromethorphan to a client who has pneumonia. The correct answer is 1. Acetylcysteine to a client who is coughing forcefully. Acetylcysteine is a mucolytic. An adverse effect of mucomist is bronchospasm. This client should be assessed for bronchospasm before administering a dose of mucomist. Cefazolin is an antibiotic. Antibiotics are frequently administered to clients with viral infections to prevent secondary bacterial infections. This client is considered at risk, or the client would not be in a hospital receiving care. There is no reason to question this medication. Diphenhydramine is an antihistamine. Antihistamines are prescribed for congestion, so there is no reason to question this medication. Dextromethorphan is an antitussive. A symptom of pneumonia is a cough, so there is no reason to question this medication. Which statement is the scientific theory for prescribing zinc preparations for a client with a cold? 1. Zinc binds with the viral particle and reduces the symptoms of a cold. 2. Zinc decreases the immune system's response to a virus. 3. Zinc activates viral receptors in the body's immune system. 4. Zinc blocks the virus from binding to the epithelial cells of the nose. The correct answer is 4. Zinc blocks the virus from binding to the epithelial cells of the nose. Theoretically, zinc blocks viral binding to nasal epithelium. Observation has shown that increased amounts of zinc can prevent the binding and prevent the development of symptoms of the rhinovirus. Zinc does not bind the viral particle. Symptoms are diminished by blocking the ability of the virus to bind with the nasal lining. Zinc is a micronutrient found in the body that helps to increase the body's immune system. Activating viral receptors would increase the symptoms of a cold. Which OTC herb should be usually recommended for a client with a cold who has mild hypertension? 1. Hawthorn. 2. Ginger. 3. Garlic. 4. Golden seal. The correct answer is 3. Garlic. Garlic is used for colds and the flu and can also be given for hypertension. It causes mild vasodilation and will not make hypertension worse. Hawthorn is used for mild hypertension, congestive heart failure, and angina, but it does nothing for a cold or the flu. Golden seal is used for respiratory, digestive, and urinary infections, but it increases the effectiveness of some antihypertensive medications, beta blockers, and antidysrhythmics. It should be used with caution in clients who have cardiovascular disease, diabetes mellitus, or glaucoma. The mother of a teenage girl asks the nurse why her daughter would have many boxes of pseudoephedrine in her room. Which statement is the nurse's best response? 1. Has your child always had allergy problems? 2. Teenagers will try to take care of their own health problems. 3. Has your daughter's behavior at school or at home changed recently? 4. Remove the medication and say nothing to your daughter about it. The correct answer is 3. Has your daughter's behavior at school or at home changed recently? Pseudoephedrine is an antihistamine and is used in the manufacture of methamphetamines. This situation could indicate the teenager is involved with the drug culture, taking or manufacturing drugs. The nurse should assess for signs of drug involvement. The client with the flu is prescribed the OTC cough suppressant dextromethorphan. Which information should the nurse teach regarding this medication? 1. Take the medication every 4 to 8 hours as needed for cough. 2. The medication can cause addiction if taken too long. 3. Do not drive or operate machinery while taking the drug. 4. Do not take a beta blocker while taking this medication. The correct answer is 1. Take the medication every 4 to 8 hours as needed for cough. Dextromethorphan is relatively safe in the recommended dose range of 10 to 30 milligrams every 4 to 8 hours. At these levels, it does not produce respiratory depression and side effects are not common. Dextromethorphan is an antitussive. This medication does not have the potential to cause addiction. This medication does not produce drowsiness, so driving or operating machinery while taking dextromethorphan is acceptable. The medication does not slow the heart rate, and there is no reason for a client not to take a prescribed beta blocker medication while taking dextromethorphan. Which data indicates to the nurse that simvastatin is effective? 1. The client's blood pressure is 132/80. 2. The client's cholesterol level is 180 milligrams per deciliter. 3. The client's LDL cholesterol level is 180 milligrams per deciliter. 4. The client's HDL cholesterol level is 35 milligrams per deciliter. The correct answer is 2. The client's cholesterol level is 180 milligrams per deciliter. Simvastatin is an HMG-CoA reductase inhibitor, or a statin that lowers cholesterol levels. A cholesterol level less than 200 milligrams per deciliter is desirable and indicates the medication is effective. The client with coronary artery disease is prescribed cholestyramine. Which intervention should the nurse implement when administering the medication? 1. Administer the medication with fruit juice. 2. Instruct the client to decrease fiber when taking the medication. 3. Monitor the cholesterol level before giving medication. 4. Assess the client for upper abdominal discomfort. The correct answer is 1. Administer the medication with fruit juice. Cholestyramine is a bile acid sequestrant. This medication should be administered with water, fruit juice, soup, or pulpy fruit such as pineapple to reduce the risk of esophageal irritation. The client diagnosed with coronary artery disease is prescribed atorvastatin. Which statement by the client warrants the nurse notifying the HCP? 1. I really haven't changed my diet, but I am taking my medication every day. 2. I am feeling pretty good, except I am having muscle pain all over my body. 3. I am swimming at the local pool about 3 times a week for 30 minutes. 4. I am taking this medication first thing in the morning with a bowl of oatmeal. The correct answer is 2. I am feeling pretty good, except I'm having muscle pain all over my body. Atorvastatin is an HMG-CoA reductase inhibitor, or a statin. Statins can cause muscle injury, which can lead to myositis, fatal rhabdomyolysis, or myopathy. Muscle pain or tenderness should be reported to the HCP immediately. Usually the medication is discontinued. The client calls the clinic and says, "I am having chest pain. I think I'm having another heart attack." Which intervention should the nurse implement first? 1. Call 911 emergency medical services. 2. Instruct the client to take an aspirin. 3. Determine if the client is at home alone. 4. Ask if the client has any sublingual nitroglycerin. The correct answer is 4. Ask if the client has any sublingual nitroglycerin. Because the client has had one MI, the client may have sublingual nitroglycerin, a coronary vasodilator, in a pocket and can take it immediately. If the client does not have any on the body, then the nurse should determine if there is anyone in the home that can help the client. The nurse is completing AM care with a client diagnosed with angina when the client reports chest pain. The client has a saline lock in the right forearm. Which intervention should the nurse at the bedside implement first? 1. Assess the client's vital signs. 2. Administer sublingual nitroglycerin. 3. Administer IV morphine sulfate via saline lock. 4. Administer oxygen via nasal cannula. The correct answer is 4. Administer oxygen via nasal cannula. The nurse would have oxygen at the bedside, and applying it would be the first intervention the nurse could implement at the bedside. The client diagnosed with angina who is prescribed nitroglycerin tells the nurse, "I don't understand why I can't take my sildenafil. I need to take it so that I can make love to my wife." Which statement is the nurse's best response? 1. If you take the medications together, they may cause you to have very low blood pressure. 2. You are worried your wife will be concerned if you cannot make love. 3. If you wait at least 8 hours after taking your nitroglycerin, you can take your sildenafil. 4. You should get clarification with your HCP about taking sildenafil. The correct answer is 1. If you take the medications together, they may cause you to have very low blood pressure. Life-threatening hypotension can result with concurrent use of NTG and sildenafil, a peripheral vasodilator erectile agent. The client is reporting severe chest pain radiating down the left arm and is nauseated and diaphoretic. The HCP suspects the client is having an MI and has ordered morphine sulfate for the pain. Which interventions should the nurse implement? Select all that apply. 1. Instruct the client not to get out of the bed without notifying the nurse. 2. Administer the morphine sulfate intramuscularly in the ventral gluteal muscle. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. 4. Administer the morphine sulfate slowly over 5 minutes. 5. Question the order because morphine sulfate should not be administered to a client with an MI. The correct answers are 1. Instruct the client not to get out of the bed without notifying the nurse. 3. Dilute the morphine sulfate to a 10 milliliters bolus with normal saline. And 4. Administer the morphine sulfate slowly over 5 minutes. The client should not get out of the bed without assistance due to the drowsiness the client will experience after receiving morphine sulfate, a narcotic analgesic. Also, the client is having chest pain and should not get out of bed without assistance. Morphine sulfate, a narcotic analgesic, is the drug of choice for chest pain, and it is administered intravenously so that it acts as soon as possible, within 10 to 15 minutes. IVP medications should be diluted to help decrease the pain when it is administered and to prevent irritation to the vein. Morphine sulfate may be administered intravenously when a rapid onset of action is desired. The dose is usually in the range of 2.5 to 15 milligrams, given slowly over 4 to 5 minutes. The nurse is teaching the client diagnosed with angina about sublingual nitroglycerin. Which statement indicates the client needs more medication teaching? 1. I will always carry my nitroglycerin in a dark-colored bottle. 2. If I have chest pain, I will put a tablet underneath my tongue. 3. If my pain is not relieved with one tablet, I will get medical help. 4. I should expect to get a headache after taking my nitroglycerin. The correct answer is 3. If my pain is not relieved with one tablet, I will get medical help. The client should put one tablet under the tongue every 5 minutes, and if the chest pain is not relieved after taking 3 tablets, the client should seek medical attention. This statement indicates the client needs more teaching about the medication. The nurse is preparing to administer medications in a pulmonary unit. Which medication should the nurse administer first? 1. Prednisone for a client diagnosed with chronic bronchitis. 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. 3. Lactic acidophilus to a client receiving IVPB antibiotics. 4. Cephalexin to a client being discharged. The correct answer is 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. Oxygen is considered a medication and should be a priority whenever it is ordered. A client diagnosed with pneumonia will have some amount of respiratory compromise, and the ordered 2 liters per minute indicates a client with a chronic lung disease. This is the priority medication. Prednisone is a glucocorticoid steroid. This is an oral preparation and one that can be given daily. This is not the first medication to be administered. Lactic acidophilus is a biologic replacement and is administered to replace the good bacteria in the body destroyed by the antibiotic, but it does not need to be administered first. Cephalexin is an oral antibiotic, but this client is being discharged, indicating the client's condition has improved. This client could wait until the oxygen is initiated. The client diagnosed with emphysema is admitted to the surgical unit for a cholecystectomy. Which post-operative interventions should the nurse implement? Select all that apply. 1. Have the patient turn, cough, and breathe deeply every 2 hours. 2. Administer oxygen to the client at 4 liters per minute. 3. Assess the surgical dressing every 4 hours. 4. Medicate frequently with morphine 15 milligrams IV push. 5. Use the incentive spirometer every 4 hours. The correct answers are 1. Have the patient turn, cough, and breathe deeply every 2 hours. 3. Assess the surgical dressing every 4 hours. And 5. Use the incentive spirometer every 4 hours. Clients undergoing surgery are encouraged to turn, cough, and deep breathe a minimum of every 2 hours. Clients diagnosed with chronic lung disease are frequently prescribed long-term steroid therapy. Steroids delay wound healing. The nurse should assess the wound to determine that the surgical incision is healing as desired. The client should use the incentive spirometer to help prevent pneumonia. Every 4 hours is an appropriate time span. The client should be administered oxygen at 1 to 3 liters per minute. Clients with chronic lung disease have developed carbon dioxide narcosis. High levels of carbon dioxide have destroyed the client's first stimulus for breathing. Oxygen hunger is the body's backup system for sustaining life. Administering oxygen at levels above 2 liters per minute at rest and 3 liters per minute during activity may cause the client to stop breathing. The male client diagnosed with COPD tells the nurse that he has been expectorating rusty-colored sputum. Which medication should the nurse anticipate the HCP prescribing? 1. Prednisone. 2. Nicotine. 3. Dextromethorphan. 4. Ceftriaxone. The correct answer is 4. Ceftriaxone. Ceftriaxone is an antibiotic. The client's rusty-colored sputum indicates an infection, and an antibiotic should be ordered. Rocephin is a broad-spectrum antibiotic. Prednisone is a glucocorticoid. Clients diagnosed with COPD are commonly prescribed a steroid medication to decrease inflammation in the lungs. This client should already be taking this or a similar medication. The client should quit smoking if still smoking. A transdermal nicotine system, such as Habitrol, would be anticipated to aid the client. Dextromethorphan is an antitussive. The client may require an antitussive, but more likely would require a mucolytic to help to expectorate the thick, tenacious sputum associated with COPD. The client diagnosed with the flu is prescribed the cough medication hydrocodone. Which information should the nurse teach the client regarding this medication? 1. Teach the client to monitor the bowel movements for constipation. 2. Tell the client that it is fine to drive or operate machinery while taking this medication. 3. Instruct the client to plan for rest periods, as this medication usually causes insomnia. 4. Explain that this medication is more effective when taken with a mucolytic. The correct answer is 1. Teach the client to monitor the bowel movements for constipation. Hydrocodone is an opioid and can slow the peristalsis of the bowel, resulting in constipation. The client should be aware of this and increase the fluid intake and use bulk laxatives and stool softeners if needed. Opioids can cause drowsiness, so driving or operating machinery should be discouraged. Opioids usually cause the client to be drowsy and not have insomnia. Hydrocodone is a cough suppressant and a mucolytic is an expectorant. These are opposite-acting medications. The client who has been using oxymetazoline nasal spray for several weeks reports to the nurse that the spray no longer seems to work to clear the nasal passages. Which information should the nurse teach? 1. Increase the amount of sprays used until the desired effect has been reached. 2. This type of medication can cause rebound congestion if used too long. 3. Alternate the oxymetazoline with a saline nasal spray every 2 hours. 4. Place the oxymetazoline nasal spray in a vaporizer at night for the best results. The correct answer is 2. This type of medication can cause rebound congestion if used too long. Oxymetazoline is a nasal decongestant. Oxymetazoline is recommended for short-term relief of nasal congestion for clients older than the age of 6. This medication is for short-term use only. Longer use can cause a rebound congestion that can be difficult to resolve. Oxymetazoline should be used every 10 to 12 hours only. Using it more often increases the chance of developing a dependence on the medication and rebound congestion. Oxymetazoline nasal spray is to be used intranasally. It is not an additive for a vaporizer. The client with the flu has been taking acetylcysteine. Which adverse effect should the nurse assess for? 1. Bronchospasm. 2. Nausea. 3. Fever. 4. Drowsiness. The correct answer is 1. Bronchospasm. Acetylcysteine is a mucolytic. Mucomist can cause bronchospasm, which will impair the client's breathing, not improve it. An adverse reaction is a reason to immediately discontinue the medication. Nausea is a side effect of many medications and can usually be managed by taking the medication with food. A side effect is not an adverse effect. Fever would result from the cold, flu, or infection, not from the medication. Drowsiness is caused by some cold and flu preparations, usually antihistamines. Mucomist causes the client to expectorate secretions, which will keep the client awake. The HCP prescribed amoxicillin clavulanate for a client diagnosed with chronic obstructive pulmonary disease who has a cold. Which intervention should the nurse implement? 1. Discuss the prescription with the HCP because antibiotics do not help viral infections. 2. Teach the client to take all the antibiotics as ordered. 3. Encourage the client to seek a second opinion before taking the medication. 4. Ask the client if he or she is allergic to sulfa drugs or shellfish. The correct answer is 2. Teach the client to take all the antibiotics as ordered. Amoxicillin clavulanate is an antibiotic. Clients prescribed antibiotics should always be taught to take all the medication as ordered to prevent resistant strains of bacteria from developing. Antibiotics do not treat viral infections, but HCPs will frequently prescribe prophylactic antibiotics for clients with comorbid conditions, such as COPD, to prevent a secondary bacterial infection. There is no reason for a second opinion, as this is standard medical practice. This is a penicillin preparation, not a sulfa medication or iodine. The client diagnosed with arterial hypertension develops a cold. Which information regarding over-the-counter medications should the nurse teach? 1. Try to find a medication that will not cause drowsiness. 2. OTC medications are not as effective as a prescription. 3. OTC medications are more expensive than prescriptions. 4. Do not take OTC medication unless approved by the HCP. The correct answer is 4. Do not take OTC medication unless approved by the HCP. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. The client should only take medications approved by the HCP that will not affect the client's hypertension. The client should be informed about the dangers of self-medicating with OTC medications. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. Efficacy of medications depends on the medication and strength. The elderly client diagnosed with coronary artery disease has been taking aspirin daily for more than a year. Which data warrants notifying the HCP? 1. The client has lost 5 pounds in the last month. 2. The client has trouble hearing low tones. 3. The client reports having a funny taste in the mouth. 4. The client has hard, dark, tarry stools. The correct answer is 4. The client has hard, dark, tarry stools. A complication of long-term aspirin use is gastric bleeding, which could result in dark, tarry stools. This data would warrant further intervention. The client diagnosed with coronary artery disease is instructed to take 81 milligrams of aspirin. Which statement best describes the scientific rationale for prescribing this medication? 1. This medication will help thin the client's blood. 2. Daily aspirin will decrease the incidence of angina. 3. This medication will prevent platelet aggregation. 4. Baby aspirin will not cause gastric distress. The correct answer is 3. This medication will prevent platelet aggregation. When 81 milligrams of aspirin, a baby aspirin, is taken daily, it helps prevent platelet aggregation, which, in turn, helps the blood pass through the narrowed arteries more easily. The nurse is administering 0.5 inch of nitroglycerin paste. How much paste should the nurse apply to the application paper? 1. A, 2, B, 3, C, 4, D. The correct answer is 1. A. The line is in increments of 0.5 inch, and the order is 0.5 inch. Therefore, the nurse should apply this much paste. The client being discharged after sustaining an acute MI is prescribed lisinopril. Which instruction should the nurse include when teaching about this medication? 1. Instruct the client to monitor the blood pressure weekly. 2. Encourage the client to take medication on an empty stomach. 3. Discuss the need to rise slowly from lying to a standing position. 4. Teach the client to take the medication at night only. The correct answer is 3. Discuss the need to rise slowly from lying to a standing position. This medication causes orthostatic hypotension, and the client should be instructed to rise slowly from lying to sitting to standing position to prevent falls and injury. The client diagnosed with a myocardial infarction is receiving thrombolytic therapy. Which data warrants immediate intervention by the nurse? 1. The client's telemetry has reperfusion dysrhythmias. 2. The client is oozing blood from the IV site. 3. The client is alert and oriented to date, time, and place. 4. The client has no signs of infiltration at the insertion site. The correct answer is 2. The client is oozing blood from the IV site. Any bleeding from the IV site, gums, rectum, or vagina should be reported to the HCP. The HCP may not be able to take intervention to prevent the bleeding during therapy, but it warrants notifying the HCP. The nurse is administering 9 o'clock medications to the following clients. Which client should the nurse question administering the medication? 1. The client receiving a calcium channel blocker who drank a glass of grapefruit juice. 2. The client receiving a beta blocker who has an apical pulse of 62 beats per minute. 3. the client receiving a nitroglycerin patch who has a blood pressure of 148/92. 4. The client receiving an antiplatelet medication who has a platelet count of 150,000. The correct answer is 1. The client receiving a calcium channel blocker who drank a glass of grapefruit juice. The client receiving a calcium channel blocker should avoid grapefruit juice because it can cause the calcium channel blocker to rise to toxic levels. Grapefruit juice can inhibit the metabolism of certain medications. Specifically, grapefruit juice inhibits cytochrome P450, 3A4 found in the liver and the intestinal wall. The nurse should investigate any medications the client is taking if the client drinks grapefruit juice. The nurse is preparing to administer a nitroglycerin transdermal patch to the client diagnosed with a myocardial infarction. Which intervention should the nurse implement? 1. Question applying the patch if the client's blood pressure is less than 110/70. 2. Use bare hands when applying the transdermal patch. 3. Date and time the transdermal patch prior to applying to client's skin. 4. Place the transdermal patch on the site where the old patch was removed. The correct answer is 3. Date and time the transdermal patch prior to applying to client's skin. The nurse should remove the old patch, wash the client's skin, note the date and time the new patch is applied, and apply it in a new area that is not hairy. The transdermal patch must be rotated so that skin irritation will not occur. Nitroglycerin, a coronary vasodilator, causes hypotension, and the nurse should question administering a transdermal patch if the client's blood pressure is less than 90/60, but not if it is less than 110/70.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.